Yeah, from Little Kim, the Queen Bee. It's ladies' night, what? It must be Angie on the mic. The butter pea, honey, got the sugar, got the spice. Roll the L tight, keep the rhymes right. Yo, I just made this motherfucker up last night. And I'm the rookie on this all-star team. Me and Kim is getting cream, like Thelma and Louise, but on chrome. Never leave that Brooklyn shit alone. So if you say it's on, then it's on. Bang this in your whips, back from Coda Roadie with the chips in the wrist. Here's a French kiss. I've dismissed all you chicks. Spit six from the 4th, 5th, make it dance. Ow! I stay focused and the dope is like a penny with a hole in it.
Hello and welcome. This is Ladies Night. My name is Ameze Obai Siagbon. It's always a delight to have you join us on the program. And as always, we've got something exciting to talk about. We never fail to bring awesome topics right here on the show and we discuss it. Yes, you can be a part of the program as well. You can go up on Facebook. Ladies Night on ITV/radio is where you should search for. And you can make your comments known right there. There's a post already waiting for you. Alrighty, guys. Now, usually we talk about anything and everything that has to do with the woman and even the man as well. Any topic at all, we talk about it right here on Ladies Night. Now today is not going to be any different. We are going to be looking at the importance of checking out your health on a daily basis. You need to do regular checkups, and I think that's what most doctors advise. And so we're going to talk about it a little. We're going to look at the different types of checkups that you can do and why it's important for us to do that. As a human being, most people tend to say, when they tell you go and do a general health checkup, you be like, I'm not sick, I'm okay, so there's really no need. But do you know that there's actually an importance of doing that? That's what we're going to be looking at today. As always, I've got beautiful ladies who are going to be talking about it with me. I've got the ever-glowing C. White. How are you doing?
I'm fine, thank you. And you?
I'm good.
Yeah, but like you talk about what we're going to be discussing today, but I just feel like sitting back, listening to you talk all through and learning more, but it's okay.
Learning more? Yeah. Seriously?
Because I feel I'm going to be a little bit
like a student
doing more
today.
Of listening. Yes, I'm going to be like a student today.
All right, we all are students. Nobody knows everything and nobody knows very little. So if you keep researching, try to learn a lot, you'll be a better person. Anyway, she's not the only one I've got here in the studio. I have a new face. I don't want to call her a newbie because she's been sitting back at home and watching us on a daily basis since the show started. Yeah. So she's going to be joining us from now on, just the way our other ladies used to do, but she's going to be doing it here in the studio. I'm talking about no other person in the person of Blessing Amos. She's going to be going by the name Amos because she wants it to be one kind of suspense kind of thing. But anyways, I think I like that. So yes, big welcome to Amos. How are you doing?
I'm fine.
It's great to have you on the show with us today. And like CY said, I feel like today's topic is going to be directed basically to you because she's more into the medical scene, and so she's going to be more knowledgeable about this. And that's what we do here on the show. We try to learn from each other. If it's something that CY is so good about, for instance, maybe making hair, like giving you that design styles, CY should be able to do that. Well, in this particular area today, we're going to be really drilling Amos. Anyways, now I'm going to start off with CY. Sorry, I have to do this. We're going to ask this simple question.
Okay.
Why do you feel, now this is not why do you know, why do you feel it's important to do a general health care checkup on a regular?
Okay, you know, a lot of people live this life of I don't care. Like they feel whenever I'm having this little symptoms, signs of anything, fever or anything, I can actually prescribe something for myself. I can just go to a chemist and get something for myself. Just say them, I'm feeling feverish, please just give me paracetamol.
Paracetamol, yeah?
Yeah, just for me to be able to calm myself. I think I'm having signs of malaria. And you know, when the moment you begin to prescribe drugs for yourself, it automatically means that you are now the doctor of yourself.
And most times it's wrong.
And most times it's wrong, which is not supposed to be so. You know, when you go for checkup, you'll be able to detect for yourself. Like doctors will be able to tell you that this is exactly what is wrong with you and not exactly what you're thinking. So when you go for checkup regularly, it saves you a lot of stress. It saves you from something minor degenerating into something big. So basically, regular checkup is something we should allow to be part of us. In as much as we know that yes, we can run down to a chemist, a nearby shop, a nearby pharmacy to get drugs for ourselves. Let's also ensure that before we take any drugs, it has to be prescribed by a doctor, not self-prescription, because self-prescription can sometimes be killing. You might be thinking it's fever, but it's not fever. It's something more than fever. So when you go for checkup regularly, it saves you a lot of stress and from something minor degenerating for something big.
Okay, so I asked C White, why does she feel that we should do regular checkups? And I'm going to direct the question to Amos now. Not why you feel now, why you know, because you're more knowledgeable about these things. So what is the reason, what are the importances of us doing a general body checkup on a regular basis?
The major reasons why we should do general checkup on a regular basis, because most times we are some persons, they have some hereditary sickness or disease they already know, so they just do it on a regular check to know how they are progressing and how it's going. And another thing, we are in a country where anybody can just go anywhere and get something, all right? But other parts of the world, you have to follow the due process. You have to, like what she said, you have to do the right thing and go to the hospital before they can sell any drug to you. But here you can just walk up to anywhere and they will sell to you. But the point is, regular checkup is for your own good, because at the end of the day, it's your health that matters. Health, they say, is wealth. If you are healthy, you can do anything, you can go anywhere. But if you are not healthy, you can't even stand up from where you are. So that's why it's very important. I know, because I've seen, all right, I've seen some people who feel I'm okay, I'm fine, nothing is wrong with me, and they may have blood pressure. Their blood pressure may be high actually, but because they are still moving about, they are still fine, they will just feel nothing is wrong with me. Or maybe somebody may be hit by a car, like road traffic accident, and maybe the person just got up and feel, there's no scratch on me, I'm okay.
But they probably have internal bleeding.
Yes, that person may be bleeding internally, unknown to that person. That person may have a fracture somewhere, all right? So these are the major reasons why we need to do regular checkups.
Okay, I think that aspect where you said something about someone having an accident and they just feel, okay, there's no outward blood or no outward sign of bleeding, and they're like, I'm okay self. But you don't know that you're actually not okay. Some people have died because of that. I've seen people who have lost their lives because they felt they were okay, but they were bleeding inside and no pain, no nothing. But they bled till they died. So I think even that situation is something that once something like that happens, you should actually go to the hospital, regardless of what of the outward injuries you sustain. You should check, do a scan, do a body checkup generally, so that you are very sure that your body is intact and there are no complications as well.
Another thing, another thing, you see where I'm not trying to spite anybody, but the point is, you see where some people will tell you, in my church, in my this, we are not supposed to do this, we don't do this, we don't do that. And it's wrong to an extent, because at the end of the day, it's God that gave the doctors the wisdom to do whatever they are doing. That's the truth. You see somebody will just fall and you tell the person, let's go to the hospital. Say, no, I'm going. It's not like I'm saying prayer is bad. Do you understand? And there are times where you need to administer the right thing according to the way it is. You just go for a checkup. Does not mean you should not pray, all right? That does not say you should not pray. I'm not trying to say
it goes to say because I hear, well, it's something we say often, doctors cure but God heals.
Yes.
So if you're going to be limiting yourself to I want to pray and I believe after praying everything is going to be okay, yes, nobody is stopping you. Just like you said, nobody is stopping you from praying. Do your prayers. But that doesn't stop you from going for your checkup. That doesn't stop you from taking your drugs that doctors have prescribed for you. Because if you, yes, your faith can actually work for you, but you still have to follow the due procedures, which is everybody have their area of specialization. Doctors are there for you and me, which is whenever we have little health challenge, we run to them. That doesn't stop us from running to God as well. Yes, pray to God about it so that whenever doctor administer any treatment to you, it will work for you. That is where your prayer comes in and your faith works for you. So yes, doctors they cure, but God heals you. So
I think your
Okay.
faith has to come with taking your drugs.
exactly, but it doesn't.
Yes.
No, some people. No, I wouldn't. I
Yeah.
wouldn't despise that. Some
Yeah.
people can tell you that I am not going to take any drugs. I
Yes.
won't go to the
Yeah.
hospital, and it works for them. So, but if you want to stick to your faith, there's no problem about that. If you still want to tell yourself that, okay, I believe God will heal me, and I still want to take my drugs. God, I've heard someone pray, okay, God, please, I want to take this drug. Please
Let it work.
Let it work
Yeah.
for me. I don't want, after this one, I don't want to take another one. It's also part of your faith.
Yeah, it's the faith, yes.
It depends on how
Yeah.
you want it. But don't just always tell yourself that this is how it's going to be. Even if you want to pray about a particular thing, you can still go for checkup. Know exactly what is wrong with you. That even if you're praying to God, you tell God, okay, God, this is the headache that this headache that He told me is disturbing me. But please, cure me this headache, heal me this headache. So
At
you
least
should
you
be
know, you have
exactly
an idea
what
of
is
it.
wrong
Yes.
with you, but not you praying to God and you're blank about what is wrong with you. You're just praying at random. So it's good you marry your prayer with your drugs and
Faith, yeah.
everything.
What
And
if
everything.
someone is here and the person says God knows everything, so He knows that it's headache that's doing you. He knows that you have stomach pain. He knows that you're, for instance, having internal bleeding. He already knows all that.
He already knows, so it depends on you. If you want, like, it saves you more stress and it gives you more attention and like focus where you are driving to when you go for your checkup. You know that, okay, this is exactly what has been wrong with me, or this is what is wrong with me. It saves you the stress of just praying and at random and like, okay, yes, God knows everything. We can't read that completely. He knows everything more than we do.
Yes.
So if you still want to hold on to that part, God, in fact, I'm not going to the hospital. You know everything that is wrong with me. Yes, it doesn't change anything. The most important thing is queuing into your faith and anything you want to do.
And another thing, you see people with zeal without knowledge. Yes.
We are all different human
Yes,
beings. Everybody
zeal
has.
without knowledge. You just want to, this is what my, as in, you need to see the way some people are so rigid. But I'm not trying to say don't trust or don't believe your pastor, all right? But you see, when it comes to the truth and fact, face it, okay? Face it. If they say, for instance, this person has cancer, yes, that is what the doctor said. You now go back on your faith and say, God, this is not what I want. Do you understand? Rather than saying, I cannot go to hospital. They will start. People have phobia for hospital. That's the truth. Like,
very true.
if I go there now, they will
detect one million
one
things.
thing or the other. Like the time Corona was very rampant. You see people say, even headache, they will tell you Corona.
Yes.
Even this one, they tell you, I'm not going. People were actually dying at home because they refused to go to hospital. They were scared to be diagnosed of COVID-19.
Well, I'm one person that would say that, well, growing up, I've always had that mindset that they fear doctors' handwriting. Truth be told, even till date, I do same. Because I remember I was sick, so I called a friend, a pharmacist, though she's a pharmacist. So I called her, I said, babe, see what is wrong with me, this and that, blah, blah, blah. So she just texted me the things I'm supposed to get. So I went to my doctor, because someone referred me to that place. He's also a doctor and he owns a pharmacy. So I went there, I said, sir, please, I want to buy this drug, I want to buy this drug. So to me, I don't even know the kind of drugs it is.
Buying,
So when I got there, when I mentioned the names, he turned, he looked at me. He said, really, who prescribed it for you? Okay. I said, it's my friend and she's a pharmacist. He said, no, I can't sell that drug for you without doctor's prescription. I was just confused. I said, really, I have to do that? He said, yes. So he said, anyway, I should come in. We sat down, we talked about it, we discussed, and he said, okay, fine, he's a doctor, he's this and that. So he prescribed for me, he gave me a doctor's report and everything. That was how I was able to get that drugs. You understand? So if it's someone that don't even know about the rules and regulation and the procedures involved, he would have just given it to me and I would just be dancing that at least I have a friend that can prescribe drugs for me. But what he said, he's head bent on getting a doctor's prescription is because if anything happens, I should have someone to fall back to that. This is exactly what happened, and he would be able to say, okay, I was the one that prescribed the drugs for her. So that's one of the reasons why it's important that before you do anything for yourself, try to consult professionals in it. You don't just begin to assume. Assumption is one thing you can't allow to be part of it because it kills. You begin to assume you know it, you can do it. It's good you assume and it works for you, but it's not something you just give it a chance to rule you.
I mean, that brings me to some women when they are pregnant, they will tell you, they have one nurse somewhere. Yes.
Like a midwife.
Like a midwife somewhere that they usually go to. That one will just rent maybe like a room for delivery, and it's very wrong, because at the end of the day, what if there are complications? How do you handle them? I think I should advise our women, go and see a gynecologist. I think it's better and safer for you, because if you buy fake, you buy twice.
All right, I like that last statement you made. If you buy fake, you buy twice. Some people think because it's cheaper, it's better for them. Sometimes cheap things will kill you. Cheap things will ruin your life. So it's best for you to go for quality and for a professional advice when you're dealing with especially the human body. Whether it's your own body or it's your child's own. Some people say, it's not my pikin, I know what thing they take before for malaria. Probably that particular malaria is mixed with something else. And so there's another drug that needs to be prescribed for that person. So don't always, like Steve White said, don't always decide that, okay, I've taken this before and it worked for me, so I should take it again. Always see a doctor, always see a professional, so it is much better for you and it's safer for you. Now, we're talking about general health care checkup right here on Ladies' Night, and we've been able to establish the major reasons why you should do a checkup generally on a regular basis. Now, there are a lot of things, a lot of tests you're supposed to do if you really want to start doing checkups. So we're going to dissect that, kind of list some of those things out. I don't know. I think, CY, do you have any idea of some tests that we can do, some checkups that we can do? Generally.
Sure. Generally. Let me not say, because a lot of people would want to limit themselves until they want to get married before they begin to carry out some kind of checkup on themselves. And we'll be talking about reasons why we should. As an individual, you have to, the kind of test you need to carry out on is at least to know your health status. One is genotype, and the other one I think we should also do is STD. Very important, because every day we are exposed, as women, we're exposed to so many things. Like you go to a bank, you press and you feel like you can't hold it, you just want to use the restroom. You go to a restaurant,
well,
so many
I
places.
don't necessarily feel STDs can be contracted from the toilets, can they?
No, STD can be contracted anywhere. Anywhere, even from your undies you wear every day. Probably you don't expose it to the sun, direct sun, or...
I feel you're going towards the aspect of infections.
Yeah, I just talked about STD.
No, STDs are sexually transmitted diseases, so which means they should be coming from sex.
Sorry,
I guess. So I think what you're... Yeah, I know, I
trying to talk about infection generally.
Infections, yes.
Yeah, thanks. So if we're talking about infection, it has to do with you, the kind of things you wear, the places you sit as a woman, even as a man, the kind of things you also wear inside determines whether you are clean or not. It cannot, if your inner wear is dirty, it can also cause you infection. So when we want to talk about STD, like I mentioned, I think I wouldn't want to digress on that one, because I don't know much about sexually transmitted infections and all that, but I know that if you're trying to have sexual intercourse with your partner, a married man, even some single people still do it. Yes, we can't rule it out, we can't deny that fact that some young women out there have sex even when they're not married. So if you want to do that, for you to avoid and prevent those sexually transmitted diseases, the best thing you can always do is protect yourself. As a woman, protect yourself. As a man, protect yourself. So the other kind of sex, I think we can also do, I think I've talked about genotype, STD, blood group. Yeah, you can also do blood group so that you know your status. You know, some people, they don't know their blood group until they want to get married. You see, before, let me go now so that I will at least, you know, we have to do all these things. Even till now, some people are still waiting till that very day. So these are the type of texts I think we should, on regular basis, try to carry out, like, as humans.
Okay. Well, Amos, can you just shed some light on that?
I think basic tests are necessary. In fact, all tests are necessary. Actually.
Okay, now if I don't have the money for all tests, which one should I streamline?
One step at a time.
Your HIV status.
Okay, yes, definitely.
Your genotype, like she said, your blood group, all right, your PCV. You need to check your blood pressure. As a female, as a woman, as a girl, as a young lady, check your breast. You find out there's any lump, you run to the nearest hospital and see if it's a benign one, To know if it's benign, they can just actually give drugs, maybe like
That is minor.
Yes, minor.
Okay.
They can just
Because
give.
some people don't know what benign is.
Okay, sorry.
Including me.
If it's non-cancerous,
Yes.
if it's a mild one, if it's a normal, if it's a good one, and they will just give you maybe some antibiotics to clear it off. Then if it's like a seed, small seed, they will first of all take a biopsy to see what it is in the lab. Okay, if it's not cancerous, they will just remove it and you keep watching. And for a woman who is above 40, you can do a mammogram to know, because as small as a cancer cell is, a mammo can pick it. All right, so for a woman who is above 40, you can do mammogram. For a young girl who is below 40 to 18 or thereabout, you can do a breast scan to know what's there. Then for a man, a young guy, I think from 30 and above, you can do a prostate scan, so just on a regular check, you know. Another thing, there are some young ladies who do not see their period.
Yeah, that's true.
Possible.
Yeah, very possible.
While
there are some, they see their period, but it keeps. It's not regular. You know, they have what we call PCOS, polycystic ovarian syndrome, all right, whereby they release more than the usual every month. And this may make them not to have children. So by the time you detect it on time, you follow it up, and you see a gynecologist, not a nurse, not a roadside chemist, all right? So there are so many.
But how do you know if you have what you just called?
PCOS.
Okay, PCOS.
Okay, there are tests. It's basically for those who do not see their period at times.
Okay, so
it skips maybe a month or 2 months, and they know. So you just have to go to a hospital. You don't joke over it like he didn't come this month, he came next month.
some people will be very happy. I think if I,
No. Those people don't know that this is
a problem.
Yes. They'll be very happy.
Wow, really?
Because you get to hear
because
ladies
sometimes
complain
periods
about
are stressful.
stressful. Sure.
Very, very. But when you remember that without this, you can't give birth.
You
you
have
can't
to
take
run.
it. You have
run.
to, exactly.
You have to run. So you see, when you see that your period skips a month, 2 months, just like that, you see a doctor, you see a gynecologist, all right? They will not tell you, okay, do so and so test, do a hormonal profile, do so and so test, do a transvaginal scan, do this, do that. When the result comes out, from there they can be able to manage that patient. So there are plenty tests to do.
A lot.
Urine MCS, I know that was where you were going to when you say if you use the restroom, you do urine MCS, urine culture, you do for a man, you do urethra swab. You know, there are so many tests to do, actually.
I told you there are so many.
When you said for a man, a friend of mine did that test, and he kept complaining, I will never do it again. I will never do it again. Like, I think they hurt, exactly. They hurt him, so he's like, never again. And I'm like, but you need to. Who even sent you in the first place? He was like, they say we should just be doing it from time to time. I was like, okay. But I think no matter how painful you think it is, for someone like me, I hate injections. So if you tell me to do a blood test, for instance, I may run. I remember when I was going into university back then, it took me like about 3 months before I was able to give myself that courage to say, okay, I'll go and do my own test. Because only the size of the injection, I'm already running.
Okay. There are other tests like hepatitis B and C. Okay, some people may just have it in B. You see some people, their eyes are yellow.
Yeah.
Their eyes are very yellow. Okay, so you need to do this test to know where you are, know your position in life. Yes, yes, because these things they don't speak. They will just be in there. They're just there. They're just there. Before the thing that materialize, you know it has gone far. You get, so you just need to do a general body checkup, and at times you just need to do it.
Okay.
But one of the things that discourage people, by the time you go to the hospital, and doctors begin to write with that their expensive writing and give you the prices, you'll feel like, please, you want to select.
Actually, it's for your good, because at the end of the day, they want to be sure. They want to rule out that it's not this. Okay, if it's not this, it should be this. Most times you feel all these tests, they are not necessary. At times, if it's not this, it can be this. Everything is based on assumption. They are just hoping, okay, if it's not this, it should be this.
Unless they want to know exactly what is the problem.
Yes, where it's coming from. Yes.
But isn't there a need for them to kind of like reduce the prices? Because even to do a malaria test, sometimes in some places the amount they call you, like, no, you get one man with them back of my house.
Actually, you are paying for the knowledge, actually. Yeah, paying for
Do they
the
pay for my knowledge now for it? Okay, well, yeah, they do. They do. They do adverts. They do stuff like that. So yes, it's true.
Paying for the knowledge,
But truth be told, I think we have to use this opportunity to advise them, because I have really had my own fair share of it. After listing everything, I was left with no choice than to select. Okay, I beg more, come on this one. Leave this one, let's do this one. You understand? Because this is something once a while, if not even twice a month, at least once a month, we will come for all this checkup. And at the end of the day,
see what, let me ask you.
Please go ahead.
If you want to buy a dress for yourself, will you not spend more?
The dress will last forever.
Don't. I will.
So why is your health? Why do you have to bargain for your health?
No, I'm not bargaining for my health.
If you are not fine, you can't dress.
No, yeah, I understand. But if you want to talk about my dress, if I want to go get a dress, and
have probably to plan for it.
I have to not really planning for it. I might just go to the boutique and you tell me that I just select 5 dresses, and you tell me that this is it. I will still have my options. I have to
you can
select.
decide to drop some.
I will decide to drop some. So it's same thing.
It's not the same.
It's same. I think I disagree with you on this. I know we're talking about my health. If I'm not healthy, I won't be able to flaunt those beautiful dresses, right? But by the time they give me 20 lists of the checkup I'm going to do, and I can't afford it, I'll go do plus and minus. I will drop some and pick up some. Just like what I will do to the dress.
You want to pick?
I will have to pick. Depending on how my body system is working.
You're not feeling fine. You feel okay, let me just do only malaria test, and your doctor say no, do PCV, do MP, as that's malaria, do wider,
it's okay,
and do other tests.
It's okay. I will welcome them. Do you know what? Please, can I be doing instrumental payments?
It's not possible.
Really?
Some doctors will tell you that because they really want to be sure. They're not saying it because they want to punish you, or they're not saying it because they feel they want the money. They're just saying it because they need to know exactly what is wrong with you. So if I find myself in such situation, please, we will negotiate instrumental payments.
Okay, I think I'll have to come in there. There are actually some doctors, like they are just after the money, actually. Let's be frank. They just want you to do all the tests.
Exactly.
And they will actually refer you to, you must go to this place just because there's something
partners.
they get. No, not partners.
No, like the people they work with.
Yeah, no, there's something they get like monthly, like a rebate
from
or
the
something from that particular place. Do you get? But it's not like whatever they are telling you to do at the end of the day now comes out normal. You see somebody will be angry. How can I spend this so amount of money? And it's normal.
On different tests, and at the end of the day, maybe only one
just
is
positive.
The rest negative. It's really painful.
No, I think you need to be happy on the contrary.
Yeah, we'll be happy, definitely. At least I'm healthy.
Oh, you'll be feeling like, who even sent me? I have to be honest with myself. Okay, I went to the market the other day. I went to buy things, and after buying the things I bought, I stopped talking to people. I was just focused. I was just working because I was asking myself, did I just spend this money? On what? I started asking myself, I would have used this money to do this one, or I would have saved this particular money. So it happens that way. You just begin to ask yourself, if I had known, would have just picked some. Now see the money I spent, and at the end of the day, everything just turned out to be negative. So it's just a natural feeling that comes out without you even planning it. But if probably at the end of the day, everything showed up negative and positive, it will now be done on you that, man, I am into trouble because I'm going to spend more.
Yeah.
You understand?
Yeah.
So it's just, let me call it a reflex action. You will never plan for it. It happens without you knowing. But within you, I know you'll be complaining, but on the other side, you'll have thank God it did not turn out to be something worse than this. So everybody have different ways of reacting to things. But please, I think I have to negotiate with you. I'll come to your hospital, please, instrumental payments. Welcome me.
Just this talk just reminded me of when my grandmom passed. We were told to do a general body test because they didn't know what was exactly wrong with her. I feel basically she had just given up. She was tired of the pain, tired of the stress, going to hospital, people poking her body, doing all that stuff. So I feel she gave up on her own. But the thing is, they told us to do a test. And we paid that money. I'm not going to disclose the amount, but it's over 100,000 naira. And the next 10 minutes, she died. Give us our money.
No.
They didn't do the test.
They didn't do the test?
She died.
And they didn't refund?
No. It's not refundable. They paid their paid. That's what they told us.
Yeah, and
I
if
feel
it's
like-
possible, they can even tell you that they've done the text.
Let's
and-
wake up. You can't die again. It was really painful, but well,
It's done.
Yeah,
Sometimes-
probably if we had done it earlier, maybe if they had decided earlier than that, we might have discovered what exactly was wrong with her and probably been able to try to salvage the situation. But I guess it was her time though.
Yeah.
Anyways, like I said, we've been talking about general health care checkups, why it's important for us to do it on a regular basis. It's not only when you're sick, it's not only when you have some symptoms. Sometimes just go ahead and do it because you never can tell. There may be something wrong with you and you don't even know. Even a doctor may not know by just looking at you, but when they do that test just to make sure, they will definitely pick up something. And well, not definitely pick up something, we don't pray for them to pick up something, but they can pick up something and you can deal with it immediately. I think that's one of the basic reasons why you should do it. It's for early detection and quick treatment so that, yes, it does not degenerate into something large that will have no cure anymore. Before we head out of the studio, because our time is fast spent, I want to ask, is there a particular place where we can go to do these general checkups? Do we just go to, like you said earlier on, the chemist, the pharmacies, or one midwife that does checkups with her hands on your body? Where exactly should we go?
Okay, I think basically we should go to a government hospital. We have a government hospital, we have like Central Hospital. We can go to UBTH. Okay, if there is any
That's
other
for people in Benin,
Yes.
because a lot of people
Okay,
watching are
okay,
not
okay.
here in Benin.
Outside Benin, you can go to any government hospital where you are, or you can go to, like we have UBTH here, we have LUTH in Lagos. All right, you can also visit any of the teaching hospitals. We have DESUT and all that. You can go to any government hospital, and when if you want to, some people say, I don't like government hospital. When you get there, the queue, before it will get on my turn, before the way the nurses or whoever, the attendant, the way they talk to patient, you want to go to a private hospital, I think you should ask questions carefully before going to any private hospital, because not all private hospitals, in quotes, are private one. Some doctors there, they are just, let me not use the word, but they are just
So I guess
there.
the word is a licensed
Yes.
doctor, okay, or a licensed private hospital.
Mind you.
Oh, some licenses?
Yes,
Wow.
they are not.
So how do we know which one is
That's what I'm
the
saying.
real
So
one?
just better go to a government hospital or a teaching hospital. I think that will be better.
All right, okay. Let's get our last word. See White, your advice to people out there on the need to do general body checkups on a regular basis.
Yes, we've spoken a lot, and I believe people has letting here. So if you want to save yourself from unwise expenses when it has to do with your health, no matter how little you feel, you're feeling feverish or anything, don't always call some of those things you're experiencing as something minor. You never can tell. From minor, it might degenerate to something very big. So always ensure that at least once a month, depending on your finance, like I don't know how buoyant you are, so at least once a month, ensure that you go for medical checkup so that you can know your health status. It's going to save you a lot from unwise expenses when it has to do with your health. So just ensure you give maximum attention to your health so that you will not end up going for shopping of clothes, and at the end of the day you will not be strong enough to wear them, just like she asked.
Are you advising yourself?
You know, she said something, so I'm just trying to make reference to what she said, so that you will not go and shop for clothes, and at the end of the day, you will not be strong enough to wear them. So if you want to always feel flying, look smart, and sharp, be good for yourself and give maximum attention to your health.
All right, Amos, how about you? Last words on the show.
Alright, same thing. And also exercise should not be out of it. Right? You want to look fit, look nice, look young. Also need to do some exercise. And you also need to go for checkup. Just as I've been saying, check yourself, do your blood pressure, check your heart, check your everything. In fact, check everything if you can check everything. Just check yourself generally and make sure that you go to the right hospital.
When you said everything, my mind just went to the teeth rather.
Yeah.
I hear a lot of dentists say you need to check your teeth on a regular basis. You never can tell. You might have a cavity that is growing somewhere. It's not paining you, it's not disturbing you, but it's digging deep, and then when it gets to the root of the tooth, it becomes a big problem. So it's also good to do regular checkup for your teeth, your eyes, even your ears, your nose, every part of your body once in a while, even if it's once in a year at least. Try to do it. Some doctors will say every 3 months, but for me, once in a year, so that, like, see what I said, you know, finish your bank accounts because of checking your body. But it's good, it's wise for you to always do regular checkups so that you can ensure that your health is intact. My name is Ameze Obaisiagwan. This has been Ladies Night, and it's been a pleasure having you join us. Like I always say, check up on Facebook, Ladies Night on ITV/radio for previous episodes of the program. Of course, you can also check our YouTube page, ITV Radio. Yes, you can check there as well for previous episodes that we've done on the show if you just want to watch them as well. We'll see you again next time. So until then, have a blessed week ahead.
The queen bee. It's ladies' night, what? It must be Angie on the mic. The butter pea, honey, got the sugar, got the spice. Roll the L tight, keep the rhymes right, yo. I just made this motherfucker up last night, and I'm the rookie on this all-star team. Me and Kim is getting cream, like Thelma and Louise.